Imagine you are home alone and suddenly a strange sensation arises in your chest. Pain, shortness of breath, unusual symptoms. Maybe it's not just indigestion? Could it be stress or something more serious? This video is not meant to scare you. I want to help you understand the situation as a cardiologist. I want to tell you what I wish my patients who have had a heart attack knew in advance. So I will give 5 key tips on how to act when symptoms appear. The first step is to be prepared. Many people think a heart attack looks like in Hollywood. The person loses consciousness and suddenly ends up in the hospital. Or that the pain must be so severe that you cannot help but see a doctor. In reality, it's different. Many patients experience mild pain. Usually, a heart attack causes a feeling of pressure or burning in the chest, as if something is squeezing inside. It is often accompanied by shortness of breath and cold sweat. The pain can radiate to the neck, lower jaw, left arm, and sometimes even the right arm. Nausea and rapid heartbeat appear. Many believe the pain must be unbearable, but that's a myth. Most patients describe it as mild, gradually increasing. At first, it's a slight discomfort that is ignored. Over time, the pain intensifies and the person begins to worry. My first advice, even if the pain is mild, do not ignore it. It could be a sign of a serious heart problem. Don't waste time. Seeing a doctor is vital. Many think that if the pain is gone, then nothing serious happened. This is a dangerous misconception. Often there is a burning, pressing pain in the chest that radiates to the neck. But if it lasts only a few minutes, patients do not seek help. This symptom is one of the most typical warnings from the body about a threat. Such signs appear days or weeks before a heart attack. Discomfort arises when walking, climbing stairs, or with light exertion. Patients stop, rest, and the pain passes, considering it muscle strain. This warning from the body should not be ignored. The substance kills heart cells. The more cells die, the more severe the consequences of a heart attack. Therefore, it is important to act immediately and not delay help. If someone is nearby, don't hesitate to say directly, "I have chest pain. I think it might be a heart attack. Take me to the hospital." Many patients lost precious time because they were embarrassed to admit it to their wife, son, or friend. They thought, "What if it's nothing?" I always say, better a false alarm than a premature funeral. Don't be afraid to seek help at the first symptoms. Another piece of advice, not all hospitals are equally prepared. Some may be overloaded and less effective in emergencies. If you just say, "I don't feel well," you can lose precious minutes. Speak clearly. "I have chest pain. I am diabetic, hypertensive." Add information. "I have high cholesterol. I think it might be a heart attack. I have shortness of breath. I feel bad. I'm afraid this is a heart attack." Your health is your responsibility. Quick actions can save your life and help the staff provide assistance faster and more accurately. This will allow you to be directed to the right specialist and avoid unnecessary questions, speeding up treatment and diagnosis. However, many people are alone at the moment of chest pain and make wrong decisions, for example, getting behind the wheel and driving to the hospital themselves. A heart attack can cause a pre-fainting state, loss of consciousness, and sharp fluctuations in blood pressure, which are dangerous while driving. Blood pressure, arrhythmia, and other complications while driving can lead to tragedy. If a heart attack is suspected, you must immediately call your country's emergency service. It is important to explain the situation clearly and briefly. It is recommended to leave the door open and lie down, so that medical personnel can quickly enter and assist if the condition worsens. Call a friend or neighbor nearby so they can help or take you to the hospital if that is faster, but calling an ambulance remains the priority. Medical personnel are trained to act in such cases. Some specialists may recommend taking 300 milligrams of aspirin to prevent blood clots. 300 milligrams is 3 small tablets, or half of a large 500 milligram tablet, or 1 gram. This can save a life. However, I do not recommend taking aspirin on your own unless a doctor has given such instructions. This is an important warning for your safety. Now I want to say something important that may seem complicated but can save a life. Monitor your condition even under severe stress or pain. The more nervous you are, the faster your heart beats and the more oxygen it consumes, which can worsen the condition during a heart attack. If you are waiting for an ambulance with a suspected heart attack, sit down and breathe deeply. Inhale should last 2 to 3 seconds, then exhale slowly. Carefully control your emotions. It is scientifically proven that controlling emotions improves survival rates and reduces the consequences of a heart attack. Be cautious with advice from social networks, which can be dangerous and incorrect. There is a misconception that coughing during a heart attack helps blood circulation and recovery. This is a myth that can worsen the situation. Coughing does not improve blood circulation or treat a heart attack and can be harmful. Doctors sometimes recommend straining or coughing during arrhythmia, but only under specialist supervision. Coughing when a heart attack is suspected is a mistake that will worsen the condition. Do not take medication without a doctor's recommendation, and do not drink water at this moment. Do not wait for the pain to pass, and be sure to ask for help. Do not drive and do not believe myths that can put your life at risk. Now that you know how to act correctly during a heart attack, I want to give 5 tips that can help prevent up to half of all heart attacks. It is a scientifically proven fact. Half of all heart attacks and other cardiovascular events can be prevented with proper nutrition and regular medical checkups. I will tell you 6 key nutrition tips in less than a minute. Number 1. Avoid excessive salt intake by choosing healthy foods, fruits, vegetables, and natural dishes, not packaged, semi-finished products. Most of the excess salt comes not from salt itself, but from processed foods. Reduce salt consumption by 50% simply by eating natural products. If you eat packaged foods, they are full of salt. The problem is not salt itself, but its excess and consuming questionable things like water with salt, which can harm health. Number 2. Reduce sugar consumption. Beware of deceptive marketing names. Brown sugar, organic sugar, cane sugar, honey, jam. They are all the same sugar, just like fruit juices. The only beneficial sugar is the one found in whole fruits, along with the peel and fiber. This helps the body absorb sugar properly and avoid harming health. Number 3. Avoid refined flour and white rice. White rice is only beneficial if left in the refrigerator for 12 to 13 hours, after which it crystallizes and becomes safer. Replace white flour with whole grain flour. White flour turns into sugar, causes a sharp insulin spike and inflammation, which harms arteries and overall health. Number 4. Avoid refined vegetable oils. They are toxic, oxidize quickly, and harm the body. Replace them with healthier alternatives. Use unrefined avocado oil or extra virgin cold-pressed olive oil. Avocado oil is suitable for cooking but not frying. Olive oil is better consumed cold. Extra virgin olive oil breaks down quickly when heated, so it should not be used for stove cooking. Add healthy fats from fish, avocado, and eggs. Your health will significantly improve by adding these foods. Number 5. Proteins. Choose proteins from white meat, fish, and avoid processed meat products. Eggs, oats, legumes, and other natural protein sources are also beneficial. They should be included in your diet daily to maintain health. Number 6. Fruits and vegetables. There is no perfect fruit or vegetable. The key is variety and alternating different colors for vitamins and minerals. Different colors of vegetables and fruits provide various nutrients, so it is important to change products daily and include them in your diet. Number 7. Physical activity. People who sit 6 to 8 hours a day live shorter lives. Regular aerobic and strength exercises extend life. Sports improve joint condition, reduce back pain, strengthen health, improve sleep, and boost mood. Physical activity is the key to longevity. Do not believe the myth that after 70 to 78 years old, sports are impossible. Under specialist supervision, exercise is allowed and prolongs life. Number 8. Control risk factors. If you have hypertension, carefully monitor your health and follow doctor's recommendations. Measure your blood pressure regularly. Monitor how you feel and maintain healthy habits to support health and normalize your body's condition overall. Take medications if prescribed by your doctor. This is an important step to control diseases and prevent complications in your body. Want a video on proper blood pressure measurement and common mistakes? Write the word hypertension in the comments to receive useful information. If you have diabetes, be sure to take medications, control your blood sugar levels, and watch your diet every day. Metformin and atorvastatin help control sugar and cholesterol, which is important for maintaining health with chronic diseases. Blood pressure medications are not toxic, despite internet rumors. If your doctor prescribed them, do not be afraid to take them. They help your health. The problem is not with the medications, but that sometimes doctors prescribe them without a thorough analysis of the patient's condition. Weight loss is an important factor in controlling blood pressure and improving the overall well-being of the body. Do not forget about spiritual health. Meditation and reflection for a few minutes a day reduce stress and strengthen the heart. Meditation helps fight insomnia and inflammation, improving the overall condition of the body and quality of life. Find time for yourself, as your body is your temple that needs care and attention daily. I hope this information was useful to you and will help maintain health and improve quality of life in the future.